Hi everyone, welcome to a brief introduction to my project titled National Multicenter Retrospective Chart Review of Adolescent Tarsal Navicular Bone Stress Injuries. The tarsal navicular bone is a wedge-shaped bone that is located in the midfoot. Its anatomical location makes it important for stability, and it plays a significant role in force transmission and push-off during gait. Injuries to the tarsal navicular are considered high risk for long-term effects such as non-union and avascular necrosis because of the complex anatomy and poor blood supply. Tarsal navicular bone stress injuries are rare in the general population. However, they are relatively common among athletes, most notably track and field athletes. In this study, we explored non-traumatic stress injuries to the tarsal navicular bone. Given the often insidious onset of these injuries, they can be more difficult to diagnose and thus have not been well studied, especially in the pediatric population. The purpose of the study is to examine and describe the characteristics of non-traumatic tarsal navicular bone stress injuries in adolescent athletes related to the mechanism of injury, diagnosis, injury severity, and recovery to assist in optimal treatment and prevention. We conducted a multi-center retrospective chart review of 50 medical records of patients between the ages of 10 and 19 inclusive with non-traumatic tarsal navicular stress fractures from 7 academic centers. Patient charts were screened using ICD-9, ICD-10, and CPT codes that described a diagnosis of stress fracture to the tarsal navicular bone. All procedures performed in the study involving human participants were in accordance with the ethical standards of the IRB. Descriptive statistics were used to analyze activity history, injury history, clinical notes, therapy, management, and radiological imaging. Sports at higher risk included cross-country, gymnastics, and basketball. The most pertinent exam findings were pes planus and navicular tenderness. MRI was often necessary for diagnosis, especially for bone stress injuries without a fracture line visible on X-ray. Although less common than other locations, we found that tarsal navicular bone stress injuries can lead to significant time loss from sport, even in adolescent athletes, with return to sport timeline of approximately 15 weeks for those managed non-operatively and 25 weeks for those who underwent surgery. Almost 1/5 of patients underwent surgery, and only one patient with a fracture line was successfully managed non-operatively. In conclusion, early recognition of tarsal navicular bone stress injuries through a focused physical exam and appropriate diagnostic imaging may decrease likelihood of surgical intervention, resulting in earlier return to sport. Thank you for listening.